and how to treat those conditions. So melanin degradation, for example, is mainly the reduction of the melanin in the skin, which means using peeling agents, lactic acid, retinol, and for example, this can be done. It works, yes, but just a little bit, because if you do it too much, you end up with an irritated skin, which in turn will have an even worse condition than the one you started with, because irritation triggers melanin production. We could reduce the melanin transfer from melanocytes to keratinocytes. This is the area where niacinamide works. Here, yep, it works, but the melanin is already there, so the efficacy is limited. If we inhibit the melanocyte activity, this goes a bit more to the core of the problem. But here, how can we just inhibit the melanocyte, not all the other cells? So hydroquinone, for example, is limited in the treatment because of the side effects. I will mention some of them in the following slides. So hydroquinone, it works, it's the gold standard. I know the dermatologists love it, but it has a lot of limitations, so it cannot be used for all year round, just for a couple of months, and then must be stopped for the rest of the year. Another way to reduce melanin is to capture, scavenge all the melanin precursors produced by the tyrosinase. This is a new mechanism, but it's not very effective because tyrosinase produces 140 precursor molecules a second, which adds up to 12 million a day. So it's very, very difficult and challenging to capture all these precursor molecules. So the most effective and most specific way to treat hyperpigmentation is to inhibit the tyrosinase activity, to reduce it to the max, because tyrosinase is the key enzyme in the production of melanin. So if we inhibit tyrosinase, there will be no melanin precursors, and in the end, there will be no melanin. This is a great idea. Unfortunately, not my idea. No, it's not even a new idea. Many attempted to inhibit tyrosinase in the past. But why was it not that successful? Because you need tyrosinase to search for inhibitors, and most of the currently used tyrosinase inhibitors are actually inhibitors of the mushroom tyrosinase, because you can buy the mushroom tyrosinase. It's the only commercially available tyrosinase. You could test the molecules, inhibit the mushroom tyrosinase, but in the end, most of them only faintly, if at all, work on human skin, because there are some differences between humans and mushrooms, and one is in the tyrosinase. So why is it so difficult to get human tyrosinase to test on? The human tyrosinase is an enzyme attached to the melanosomal membrane. That's different from the mushroom tyrosinase. So it's not soluble, and if you want to extract it from human skin, you would need square meters of human skin to have enough tyrosinase. Impossible to do it. But we did not give up. We wanted to have a recombinant human tyrosinase. I contacted several molecular biologists, famous colleagues, dermatologists running huge genetic units around the world, but they all told me it's not possible. This enzyme is way too complicated. I tried it myself, it didn't work. But we did not give up, and together with Klaus Heinrich Röhm from the University of Marburg in Germany, we succeeded. We produced a human soluble active tyrosinase, a perfect tool to test for inhibitors. And this is what we did. We tested more than 50,000 ingredients to find the one ingredient that really would do the job. This was a really long story, and to cut it short, after the 50,000 we ended up with a molecule that is here on the left-hand side. It worked, yes, but by no means this was an ingredient that you would want to have in a cream. It smelled like hell, it was unstable, it discolorized all the formulations, and it crystallized. So we had to modify it. And we modified almost every position in this molecule. And to cut a long story short, on the right-hand side, you see the compound 630 of more than 700 molecules we synthesized after the 50,000. On the bottom, you see the chemical name. I would not dare to pronounce it. Even the inky name is way too complicated, so we shortened it and we call it Thiamidol. So, how does it work? Let's go back to the tyrosinase. Here on the left-hand side, you see in this model two cyan-colored balls. Those are copper ions. These copper ions are very important, essential for the activity of the enzyme. If we block one of the coppers, the enzyme would not work anymore. We now zoom in. We see that thiamidol perfectly fills the active site of this enzyme. And if then one of the hydroxy group of thiamidol binds to one of the coppers, the enzyme is not working, it's dead. But this is not enough to make it a good inhibitor, because this binding has to stabilize to keep thiamidol in the active site, to block consistently. And this is where all the other amino side chains come into play. They bind also to thiamidol, stabilize the binding, and now the enzyme is dead. Like a cork in a bottle, thiamidol blocks the enzyme. Nothing can get in, nothing can get out. This is how it works on the active site. What does it look like in cells? This is shown here on this slide. On the left-hand side, you see melanocytes in culture. They are nicely dendritic. They produce melanin. That's why they appear brown. If we cultivate them for 2 weeks with thiamidol, they are almost invisible. You do not see the pigment anymore. They produce only faint amounts of melanin. So in cell cultures, thiamidol works perfectly. So how does it compare to other compounds? We know already compounds that at least claim to be tyrosinase inhibitors. To compare molecules, we need to calculate a parameter called IC50, inhibitory concentration 50%, which means 50% of the enzyme activity is blocked. This is shown here with the 50% line, and also on the x-axis you see the concentration in a log scale. So the most important, the most effective compounds would be on the left-hand side. Only faint inhibitors would be on the right-hand side. We now look at compounds like hydroquinone. We do not reach the 50% margin, which means it's not an inhibitor of tyrosinase, at least not of human tyrosinase. You will find dozens of papers claiming that hydroquinone is a tyrosinase inhibitor. This might be true for the mushroom tyrosinase, but clearly not for the human tyrosinase. If we now look for arbutin, which is a natural derivative of hydroquinone, yes, it looks like it works like hydroquinone. We see one hit on the 50% margin, but this is at 5,000 micromolar. This is a very, very high concentration, which you would never achieve in human skin. So it's not really working. Let's have a look at kojic acid and butyrresorcinol. Kojic acid, very popular in Asian products. Yes, here we see for the first time a nice sigmoidal curve. The IC50 is at around 500 micromolars, which is quite high. Butyrresorcinol has an IC50 of 20 micromolar. Here, this is in a range where we can expect some efficacy. But let's have a look at Thiamidol. The IC50 is 1 micromolar, 20 times more effective than butyrresorcinol, 500 times more effective than kojic acid. This is a true inhibitor of the human tyrosinase. Let's compare two other ingredients in a skin model, artificial skin model, where we see the efficacy on melanin production on the melanocytes in these skin models. We look at the control pre-incubation, we see almost no melanin. After 2 weeks of incubation, on the right-hand side, upper panel, we see a lot of melanin production in these skin models. With Thiamidol, only faint amounts of Thiamidol are produced after 2 weeks. Cysteamine, niacinamide, and azelaic acid in this assay, they show no efficacy at all. So Thiamidol perfectly inhibits the production of melanin in skin models. Efficacy is one point. The other, of course, is safety. Let's have a look again at hydroquinone. On the left-hand side, this is data I already showed before. You see Thiamidol, a perfect inhibitor of the human tyrosinase, hydroquinone not, but we know it works in human skin. So what does actually happen? Here we incubated Thiamidol in melanocytes and also with hydroquinone for 2 weeks, which brought down the melanin production to 85% with hydroquinone and to less than 60% with Thiamidol. And then we wanted to see what happens if we remove the active ingredient. And we can see that within a week, the Thiamidol-treated melanocytes are back to normal. They produce melanin like they did before the treatment. So Thiamidol is a reversible competitive inhibitor of human tyrosinase. In contrast, hydroquinone is not, the cells are not recovering at all. Even 2 weeks after incubation with the active, they still remain at 85% melanin production. So hydroquinone works via a toxic mechanism on melanocytes. This is why you cannot use it all year round, and the Thiamidol data show this is a transient competitive inhibition, reversible, and this is why you can use Thiamidol all year round. The main risk of hydroquinone treatment is a condition called exogenous ochronosis. In this condition, there's a production of bluish pigments deep in the dermis. So this is a rare disease, but hard to treat and feared by all the consumers and the dermatologists. It's not melanin that is causing the bluish-brown pigment spots. It's an ochronotic particle which develops around photo-damaged collagen fibers deep in the dermis. How does it occur? This is something we published recently in the British Journal. Hydroquinone, I told you already, is not an inhibitor of tyrosinase, but it is a substrate. So hydroquinone is a substrate of tyrosinase. It's activated by tyrosinase, and this highly active kinones, they react mainly in the melanosomes and form an hydroquinone melanin. So most of it is expelled and shedded from the surface. But some of these highly activated molecules, low molecular weight, they manage to penetrate deep down in the dermis, bind to damaged collagen fibers, and build up an ochronotic particle. This is truly a side effect of substrates of tyrosinase like hydroquinone, but not of inhibitors, true inhibitors like thiamidol. So thiamidol cannot cause a condition like exogenous ochronosis, so it's a safe even for long-term use. Now I would like to show you some of our efficacy data. In this study, we compared the treatment with 2 products versus 1 product, 4 applications versus 1 application. And you clearly can see that the 4 application treatment is more effective than the 2 application treatment with 1 product. But 1 product alone is already significantly effective, but more treatments increase the efficacy. We see the first visible results after 2 weeks, which really is surprising to me as a scientist. And if we compare the efficacy of the treatment, the range, 2 products versus 1 product, 2 times more effective than just the 1 product. And it resulted in a 75% reduction in the pigment spots after 12 weeks. Amazing results. Next, we wanted to see the effect of a long-term treatment. Most of our studies were 12 weeks, which resulted in significant efficacies. So we were very pleased about that, but we were always asked about the long-term effects. So we designed a study over 24 weeks, and the results are here. Sunscreen alone already reduced the pigment scores, but even after 4 weeks and over the entire duration of the study, we see a clear efficacy of the thiamidol-containing products versus the sunscreen. We can see here also is when we stop treatment, within 3 months, the scores are back to sunscreen only. Here again, we see the reversibility, the mildness of the approach with thiamidol. And not only the dermatologists saw the difference, also our subjects confirmed, and they saw an increase of their quality of life of 91%. Amazing results again. Next, I would like to show you some efficacy on post-inflammatory hyperpigmentation, a condition which is hard to treat. On the left-hand side, we mimicked surgical procedures. So here we raised suction blisters, removed the blister roofs, and monitored the development of post-inflammatory hyperpigmentation on the spots. On the upper panel, you can see that the 2 suction blisters were visible at baseline, and after 12 weeks, still there you can see the spots here. After thiamidol treatment, they faint away, and after 12 weeks, they are almost not visible anymore. So this is a clear efficacy in post-inflammatory hyperpigmentation in a post-procedure model. And on the right-hand side, you see the results of a real study on acne-induced post-inflammatory hyperpigmentation in darker skin types. And again, we see a nice efficacy of the treatment of the spots. In dark skin, there's always a concern of the lightening of the background skin. So we also investigated this, and as shown here, we see that the The background skin did not lighten up while the spots become less visible. So this is amazing results in skin of color. We treat the spots, but the background skin is untouched in its skin tone. In result, we already now had more than 120 clinical trials proving the efficacy of Thiamidol. The products were tested on more than 9,000 participants in 28 countries. Now, the publications on Thiamidol reach 30 peer-reviewed papers, and our data show that it is safe and effective in all phototypes. This is our data. At the end, I would like to show you some data which came from another group. The first papers were published by us, but now we see that dermatologists, you use the products in studies and publish the results, which is amazing. Klickmann's trio is the most effective formulation to treat hyperpigmentation. And Thierry Passeron from Nice wanted to see the efficacy of a thiamidol-containing product versus Klickmann's trio. He produced a so-called new trio where he used our night care product and added retinoic acid and dexamethasone and compared it to the original Klickmann's trio with 5% hydroquinone, 0.1% retinoic acid, and 0.1% dexamethasone. The treatment was 3 months with a follow-up of 3 months, where the subjects only use photoprotection. And here are the results. The new trio with Thiamidol reduced hyperpigmentation by 63%. The original Klickmann's trio reduced hyperpigmentation by 39%, which is lower, but there was no statistically significant difference between both treatments. If we look at the evolution over time, we see that after 3 months, there was a slight recovery of the new trio, while the Klickmann's trio stayed at the same level, but there was no statistically significant difference between those. But there was a difference in the quality of life measurement. Only for the new trio, we saw a significant increase in the quality of life after treatment. And also there was less side effects, less irritation with the new trio. This is obviously because hydroquinone is not that, is a bit irritating to the skin. So the new trio was at least as good as the original trio, but with less irritative side effects. And with this, I would like to close my presentation and thank you for your attention.
Thank you very much for that stimulating talk. We have another 15 minutes. So, Natalie, are we going on with the presentation? Hello?
Yes. If I may, I would now share my screen. Is that fine?
Okay.
Yes. There you go.
Okay.
Right. Can you see my screen?
Yes.
Yes, Barbara.
Perfect. All right. Then also hi from my side. Thank you for having me today. Just want to introduce myself briefly. My name is Barbara Schuster. I'm the Global Medical Manager for Hyperpigmentation at Bayersdorf. I'm an epidemiologist by training. I did my PhD in medical research at the Department of Dermatology at the University Hospital in Munich and joined Bayersdorf roughly 5 years ago, most of the time working on the topic of hyperpigmentation. And now it's an honor to be with you today and to kind of support the lecture by Dr. Ludger Kolbe, the inventor of Thiamidol, by showing you how you can bring the science, this incredible science of Thiamidol to your patients. And just as a very short recap, I just want to highlight again what Dr. Ludger said, what makes Thiamidol special. It's just a very short recap. As he said, previously, only mushroom tyrosinase has been available to screen ingredients on. And those ingredients that were screened on mushroom tyrosinase did not prove to be very effective on human skin. And thanks to Dr. Ludger's great work and at the team, they were the first to get the human tyrosinase to test ingredients on, and this is how they got Thiamidol. And
Barbara, sorry, can we just ask for Dr. Sabiti to mute? Dr. Sabiti, we're not able to mute you.
Dr. Ludger and the team, they were
Dr. Abdullah, please mute the person speaking.
Great. I think, Barbara, then we can continue. Sorry, apologies.
All right. No worries. It's always a little bit difficult with Zoom, right? So I just wanted to highlight again, what makes Thiamidol so effective is really its unique shape. And Dr. Ludger already explained everything, how it fits perfectly into the active center of the tyrosinase. What I really like to show is here also this image of a bottle with a cork. I think there's still someone not muted, right? Unfortunately, I can't mute it myself.
I think it's Dr. Sabitu. Dr. Sabitu, I don't know if you can hear us, but if you can just please mute yourself. Yes, perfect. Then we can go. Now it's confirmed. Thank you. Sorry, Barbara. Now you need to unmute yourself.
Now, okay. Now it should work. Let's give it another try. Thank you very much. So I was just saying what I like to use as an image of how Thiamidol really works is like if you think of a bottle with a cork in it, because Thiamidol really locks the activity of the tyrosinase, so it can't produce any melanin anymore. Nothing can get in, nothing can get out, so no melanin will be produced. But Thiamidol is not just any bottle, but Thiamidol is actually a very nice bottle of champagne, because it's not only a cork that's in the bottle, but it's also very nicely screwed on with this metal thing, because it has amino acid side chains that can bind also to the tyrosinase, stabilizing the inhibition. And this is really what makes the difference. It's not just an inhibitor that will stay in the active center for a second, and then if there's some pressure on the melanocyte, if the melanocyte is activated, it will just go away and the inhibition won't last. But it's very, very safely locked here into the active center of the tyrosinase. This is what makes it so effective. And as Dr. Ludger already showed, of course, we have tested Thiamidol extensively against other tyrosinase inhibitors, really, as tyrosinase inhibition is really the most targeted solution to reducing hyperpigmentation. And we wanted to see, of course, how Thiamidol compares. And as you can see in these curves that Dr. Ludger already showed, or he showed some of them, like, for example, the hydroquinone or the kojic acid. But here you can see even more cosmetic ingredients that were included, such as niacinamide, for example, and they don't show any inhibitory efficacy at all. So it's really a different mode of action, and Thiamidol really is the most effective tyrosinase inhibitor that's available. And this was, of course, the start for us at Eucerin to develop now products that can make it possible to bring the science and this amazing ingredient out there to the world, out there to the patients that are affected with hyperpigmentation, and most importantly, out there to you as dermatologists, so you can help your patients to treat their hyperpigmentation concerns with it. But when we at Eucerin, we design a product, of course, we need great ingredients such as Thiamidol, but we always think about what can we do more, what can help additionally to support Thiamidol. And this is why in our Even Pigment Perfector products, we don't only have Thiamidol, even though, of course, this is the powerhouse, but we also added some licorice, some Lycocalcone A, which is a licorice root extract. And it is really known for its anti-inflammatory and antioxidative efficacy. And this is really important as well, because if we think of hyperpigmentation, it's not only what happens in the melanocyte, but there's also a lot of surrounding factors and aggravating factors that influence the production of the melanin in the melanocyte by stimulating the melanocyte activity. So the first thing to mention, I think this is a very prominent one, is of course inflammation. You all know this very well, that inflammation processes can stimulate the melanocytes, leaving post-inflammatory hyperpigmentation. This is a big concern. I don't need to tell this to you, especially in darker phototypes, because they are more prone for stronger inflammatory reactions. So there you need to be especially careful, and this post-inflammatory hyperpigmentation, you all know this, lasts very long. So it's important to find something that also helps against inflammation. And also there is a vascular component to hyperpigmentation. I'm sure you are aware of this as well. So the endothelial cells produce some mediators, especially endothelin-1, which also stimulate the melanocyte production. And we have seen that, for example, in patients with melasma, you can really find in the pigmented areas also a higher vascularization, and this is really connected via these secretion of these mediators such as endothelin-1. So additional aggravating factor of hyperpigmentation. And then last but not least, of course, blue light. We all know this. I think today there's a lot of more awareness on this topic, that the sun exposure is more than just the UV radiation, which is of course important and the key to protect from UV radiation, but also the blue light, actually, the visible high energy visible light plays a big role here, and it's causing oxidative stress in the skin, which is stimulating the melanocytes again, and thus also aggravating the hyperpigmentation. And it's great that we have this ingredient, licocacoin A, in the product as well, because licocacoin A reduces the secretion, the cytokine production, for example, interleukin-6 or TNF-alpha. So it really helps to reduce the inflammatory reactions and to kind of protect the melanocytes from the pro-inflammatory cytokines. At the same time, it also works against the vascular effects by reducing the endothelin secretion from the endothelial cells. So also this aspect is covered here. And last but not least, the licocacoin A also helps against the oxidative stress caused by blue light. And on the graph here on the left, you can see again that we know really blue light enhances hyperpigmentation, especially in areas where there is already hyperpigmentation present. And on the right, you can see that if you treat the stressed skin also with licocacoin A, this will reduce the melanin production and the tanning in these areas. So this is why it's great that we have in our products not only the Thiamidol, but also the licocacoin A. And for me, I like to use this image of the bottle. If we think of Thiamidol like the cork in the bottle, what licocacoin A is, it's like a wine cooler. It's keeping the bottle of champagne, the melanocyte, which has a lot of pressure in it. It always wants to produce melanin. It's kind of keeping it nice and calm, while Thiamidol really is the cork. It makes sure that no melanin can be produced. But still, you wouldn't want to shake a bottle of champagne. You wouldn't want to put it in the sun. This will cause additional pressure. And this is kind of what licocacoin A does. It's keeping the melanocyte calm and nice and protects it from additional stressors. And this is why this is also another key ingredient that we have in our Even Pigment Perfector range, and which we also have in our Even Pigment Perfector Sun Care, which also contains Thiamidol and combining it even with an SPF 50+, so really a very, very high protection against UVB and also UVA, of course, but also containing the licocacoin A for the protection against blue light. And now that being said, a question that we often get is like how to use the products. How often do you need to use them? And I brought here a study that Dr. Ludger already explained to you. But just what I want to show here is that in this study where they tested really to apply just one product with Thiamidol in the morning and the evening, or to use a combination of the products. And what we saw here in the study is that even if you use just one product twice a day, you can see first visible reduction of hyperpigmentation after already 2 weeks, with an increasing efficacy if you use it for a longer period of time. But if you even add on another product, and this means now 4 applications of Thiamidol, you will get even better results. And this is why we created a very simple routine for the patients, because it always sounds like not feasible to apply 4 times a product. But actually, we made it easy by creating a serum, which they can use as first step in their skincare routine. And then we have, for example, our sunscreen product with the SPF 50 that they can then use as a protection on top and as the sunscreen, which would be needed anyways. And this they can then do in the morning, and they can do it in the evening. And by this, they get to 4 times application of Thiamidol by using just 2 products. But again, even if you only use one of these products in the morning and in the evening, or in case of the sunscreen, if you use it in the morning, maybe in the afternoon, with 2 times application of Thiamidol, you will also get great visible results. And I brought some pictures here. This is a very pronounced case that we saw in the study that I just showed you with the 4 times application of Thiamidol. And it's really amazing to see what a difference it has.
Pigments.
And another study I would like to show you is actually a real-world study that we have conducted in 11 countries with more than 600 patients. And the study was really conducted by dermatologists all over in these 11 countries, and that included their own patients into the study. And it was done also with our even pigment perfector regimen. And what we could see was a very impressive reduction of the MASI score by -76% after 12 weeks of use. And also very important, and this should never be forgotten in case of hyperpigmentation, especially where we know irritations can trigger hyperpigmentation, that the products were very, very well tolerated by 98% of the participants. And also a number that I really am very proud of is, you can see in the bottom left, 99% of the dermatologists that were part of the study said they will recommend the products also to their other patients with hyperpigmentation. Now, another question we often get is, how long should the patients apply the products and what happens if they stop? And Dr. Ludger already showed this study where we tested our Thiamidol or our even pigment perfector regimen versus a vehicle study, versus a vehicle formulation with an SPF as well. And what I would like to highlight here is that we see really the strongest effect of our product, even though we have the first visible results after 2 weeks, which is important, but the strongest result we will see after 3 months of product use, especially in the first 8 weeks, but also from 8 to 12 weeks, it's a big increase. And even this, so this is really the period that we would ask the patients really to stick to it to get the best results. But if they use it even longer, the results will get even better. So even after 6 months of using the products, we could still see an improvement of the pigment spots. So as we know that for especially melasma is chronic and recurrent, we can encourage them really to use it for a longer period of time. This will increase the results that they will see. And we also know from the study that the products are very good, well tolerated, even if you use it long term. Still, we also wanted to see what happens if the patients stop using it. And what we saw here in the study was that 3 months after ending the study, there was still 50% of the MASI improvement still visible. So it's not like they need to be afraid that everything, the whole effect will go away when they stop. But in the end, as Dr. Ludger explained, Thiamidol has a reversible mode of action, which actually is very important for its safety. It doesn't cause any permanent damage to the cells, but just inhibits the enzyme. So once you stop the use, the effect of Thiamidol will be reversible, but we still see more than 50% improvement after 3 months of stopping the product use. As Dr. Ludger already shared, there's a lot of evidence, and I just want to show you a few additional studies that I think will be especially interesting to you. One is a publication on a post-inflammatory hyperpigmentation, especially focusing on phototypes 5 and 6. We have both a vehicle-controlled study that was conducted in Brazil in participants with phototypes 5. And here we saw a significant improvement of the PIH with using Thiamidol compared to a vehicle at all points of time, even starting from 2 weeks. And most important, an excellent tolerability also in these darker phototypes. And on the right, you see images from an observational study that was done by Professor Nkosi Dlova from South Africa. I'm sure a lot of you will know her. She did one of the first observational studies really in her practice with patients with phototypes 5 and 6. And here she also saw a significant improvement versus baseline without any lightening of the surrounding skin, just an evening out of the skin. So this is, of course, extremely important for us, that we never want to lighten the overall skin tone, but we just want to help even out the hyperpigmentation and get an even skin tone. And we even, and actually PIH, as I'm sure you know, it's not that easy to treat. So what I brought here is a systematic review that was conducted last year by a group of researchers and published in the Journal of Cutaneous Medicine and Surgery. And what they saw here, what was their conclusion after doing this literature research, was that among the available studies, there is a lack of robust efficacy across all treatment modalities. But what they saw is that the only treatments with notable success over no treatment were Thiamidol, laser therapy, and topical retinoids. So this is really great to see that Thiamidol can have such an impact even on these hard-to-treat conditions. Now, what I just would like to briefly mention is that Thiamidol also works great in combination with cosmetic procedures. So this, what you can see here, is a study done by Professor Vasanop Vashiramon from Thailand. And he used Thiamidol, especially our dual serum here, adjunctive to laser treatment for melasma. And he saw that it even enhanced the efficacy of the laser treatments. But I think what will be even more interesting for you is the second study that he did, because we know that laser treatments for hyperpigmentation, especially in darker phototypes, are very risky because they have the risk of aggravating the hyperpigmentation actually and causing post-inflammatory hyperpigmentation. So what he did in the second study is that he pre-treated the skin before laser treatment with Thiamidol, with our dual serum twice daily. And he saw that this significantly reduced the risk of PIH after these laser treatments. It was done in Thailand, so as you can see the pictures and the conditions here, it's probably not that much what you see in Europe, or not what you see mainly in your practices, but especially in dark phototypes, of course, it's very, very important to prevent PIH. So this is why I really wanted to show you this study as well, to show you Thiamidol not only helps to reduce PIH, but to also prevent it. All these studies, and not only the studies conducted by us, but most importantly, studies conducted by your colleagues, your fellow dermatologists, and also yourself, they really help us and are the reason why we are the #1 even skin brand globally. And this is also what I'm especially proud of, is that we are also the #1 dermatologist recommended brand for hyperpigmentation globally. And I just want to end this with a very brief teaser. And now you can see in both presentations, we mostly talked about hyperpigmentation on the face. But as I'm sure you are very well aware, is that it's not only a face concern. Hyperpigmentation also concerns the body. So the data you see here is from a global study. It didn't specifically focus on Africa. I could imagine that in Africa, we would see even far higher prevalences in body hyperpigmentation, but still also in this data, third person also had hyperpigmentation on the body. And areas that are coming here are, for example, the back, if you have acne patients with PRH, but also the armpits or the elbows and knees, and also sun-exposed areas, especially in lighter phototypes. And I just want to give you a little teaser. We have already some great data to show that Thiamidol also works for hyperpigmentation on the body. And please stay tuned for new products that will come to the market also soon to help you treat your patients also with hyperpigmentation on the body. And with this, I would like to thank you very much for your attention. And now I'm happy to answer your questions.
Thank you very much, Barbara. Both presentations, the first one by Dr. Colby and the second one, they're quite interesting. So do we have questions? There were some questions on the chats. One has been answered. The other question was, why does Thiamidol not lighten the skin around the pigmentation since it's a tyrosinase inhibitor?
Yes, it's a good question and a very important question, and a question we also often get. So there are two parts to this answer. The first one is that if we look at hyperpigmented areas, this is where the melanocytes are very active. This is why there is an overproduction, a local overproduction of the melanin. So where the cells are very active, there's a lot of tyrosinase to inhibit. So if we put the same amount of Thiamidol on hyperpigmented skin as on the surrounding skin, the Thiamidol has more opportunity to do its job and has more effect on these areas where there's a lot of tyrosinase being produced and where there's a lot of melanogenesis taking place. This is why the effect of Thiamidol is stronger in these areas where there is a lot of hyperpigmentation, a lot of melanocyte activity. The second part of the answer is that, of course, we made sure with our products, with the concentrations that we use, that this does not happen. So we really did this extensive testing to ensure that the concentrations that we have in our products do not lead to any lightening of the surrounding skin. So it's both the product composition, but also the mode of action of Thiamidol, which works more, or which can show its effect more on areas where a lot of melanin is being produced. These are the hyperpigmented areas.
Thank you very much. There's another question which says, does one need to keep using Thiamidol continuously in order to maintain the effect on hyperpigmentation?
So as we've heard, Thiamidol really has a reversible mode of action. I know this is a little bit bittersweet because, of course, we would love to have something that just cures it, but it's not a cure, it's a treatment. But it's also very good that Thiamidol is reversible, because this really means that it's not causing any permanent damage to the cells. It's not harming any cells. It's just inhibiting this enzyme. So it's actually really speaking for its safety that it's reversible. But this also means that if patients want to maintain their results, they need to continue using Thiamidol. Otherwise, there will be some kind of relapse here. But what we can tell them for sure is that they can reduce the number of times they need to apply Thiamidol. So they can go, if they used it 4 times before, for example, they can go to 2 times, or even go to 1 application of Thiamidol per day. So for example, just using the sunscreen with Thiamidol. If you have already good results, less number of applications can help also, but they should still incorporate it into their routines to some degree. Otherwise, the hyperpigmentation will come back, especially in melasma, of course. It's a different thing with PRH if the inflammation is gone.
Okay, thank you very much. We still have a couple of minutes. I don't know if anybody still has any question. It's been quite an interesting presentation. I think one major takeaway is Thiamidol is the tyrosinase inhibitor, while hydroquinone is a tyrosinase substrate. I think that is quite interesting.
Absolutely. And I think something that has been like, it has only recently been understood. So it's something where there's still a lot of new insights to gain, and definitely one of the key takeaways.
Yeah, it's quite interesting. Do we have any other question? Okay, I think it's been a very interesting presentation. We all know that with our skin types 4 to 6, hyperpigmentation, post-inflammatory hyperpigmentation is a big problem. And with the new products you have for the armpit, for other places in the skin, because for females in between the thighs where it rubs is also a problem. The lower legs, the armpit. So it's getting more and more interesting. I think you're having what we'll call precision medicine. So somebody walks into the clinic and I'm able to say I have a product for the armpit, I have a product for the in between the thighs. So in the absence of any questions, I'd like to thank Birsdorf before I hand over to Dr. Akikugbe. So thank you very much. It's been quite stimulating.
Thank you very much.
Aisha.
Thank you for having me.
Okay. Aisha.
Yeah, thank you very much, everybody. Good evening again. Thank you for the presentation and the questions as well that were well answered. If there's no other pending issue, then I'd like to say thank you very much to Eucerin, Biosdorf, to Barbara and Natalie, and of course, Dr. Kolbe and our moderator. Our next webinar will be next month, and we'll see you then. Thank you very much, everybody.
Thank you
so much. Thank you so much.
Bye.
Bye-bye.